Well, good morning to you. I'm happy to have in studio this morning the Mason County Health Officer, Dr. Diana Yu. Good morning.
Good morning.
Good to see you. April Public Health Month. Thought we should bring you in to talk about some things going on around Mason County. First off, kind of give me an overall health picture of Mason County. Are we healthy here in the county?
Yeah, we actually are pretty healthy. We're a healthy county. When you look at the national health ranking, actually, if you look at the Washington State health rankings, there are 39 counties in
Uh-huh.
the state, and we rank in the lower third of Washington State. But if you compare that nationally, because Washington State is such a healthy state, we actually are really, really good
Oh,
compared
wow.
to the rest of the country. So I'm not disheartened because we're competing with our neighbors here, and we're all, if somebody gets a little healthier, then somebody else moves down the
Yeah.
ranking because there's only 39, and somebody has to be one, somebody has to be 39. But overall, I think we are doing really well, and we continue to improve our health.
What are some of the ways that we see Mason County, the major causes of death in Mason
Yeah.
County, and some ways that folks can key in on that, and maybe look to start getting some help?
Yeah, still today, the top three causes of death in our county is heart disease, lung disease, and cancer.
Hmm.
I don't think that has changed for a long time. When you actually boil that down to the true cause of death, the number one cause of death is still cigarette smoke
Okay.
or tobacco use. And so when you talk about heart disease and lung disease and cancer, if you are a tobacco user and you choose to make a difference in your health, quitting tobacco use is the one thing that's going to really, really, really improve your health and your longevity,
Mm.
and the quality of life. There's a lot more treatment available now for that. So, it's a matter of it. I know it. Don't tell me to quit smoking. I know it's bad for you, and you people tell you that all the time. So we work really, really hard to prevent initiation of tobacco use, because if you can get somebody not to start using tobacco, then on the front end, prevention is a lot easier than trying to quit once you've become
Sure.
addicted to tobacco. So heart disease, a healthy diet, physical activity, getting in your 30 minutes of quality exercise every single day, and be that just walking around town doing little things, running up and down the sidelines when you're watching your kids play soccer. It's better than standing still or sitting down when
Oh,
you watch. I
yeah.
mean, it's
Yeah.
it's 30 minutes, and most of us can get in 30 minutes of physical activity every day.
So
And
is it, when they consider that, is it an elevated heart rate to a certain level,
Um,
or do they
yes,
consider exercise?
yes, and something that elevates your heart rate, something that is sustained, and you don't even have to do 30 minutes at a time. You can do 10 minutes, 10 minutes, 10 minutes. But exercise is actually quite addicting. So myself, my form of exercise is dancing, and
Uh-huh.
a lot of my friends, we dance for exercise because we don't feel like we're exercising, and yet we are, improving our flexibility, our stamina, our cardiovascular, um, you know, endurance, and all of that. So it's good. Whatever you like to do, just get out, or even stay inside and do 30 minutes of physical activity every day.
Huh.
And that would really help to improve your health. Um, Eating a good diet, high fiber, lower carbohydrate, lower sugars, drinking a lot of water every day. I mean, people say, well, doctors don't really know about diets. They're not, and in some sense, it's true. And I like to say a well balanced diet, something that mixes a lot of different colors, gives you a lot of different nutrients. Sticking to one diet, one type of food is just not good for you.
Right.
And people talk about, well, was the paleo diet or the should I eat only organic foods? That's your choice. You know, Food is food, and I think having access to quality fruits and vegetables is really good for your diet. If that's not part of your diet, trying to include that in your diet would be a good thing.
Those are some good tips there.
Yeah.
Last September, you and much of the community involved in a conversation about the opioid epidemic here in the county.
Yes.
How was it from September to now and looking forward?
Yeah. So, substance abuse is something that has been an issue in our community as long as I've been here and way before I came. But it was only within the last year and a half where the community really started to get together, started clamoring for more, started understanding that we do have a problem in Mason County. It does not cause the most deaths, but it certainly does affect the quality of life. It affects people from all walks, our law enforcement, our criminal justice system, our families, our schools. Substance abuse is a big issue. And in September, we had a community forum that was very well attended. And since then, we have had a number of different work groups that have gotten together. And as a matter of fact, there's another one coming up on April 5th, which is Wednesday night, over at the library, at the Shelton Library. We are going to have an overdose prevention forum. And everybody is welcome. It starts at 6 o'clock. And we're going to talk about how we can prevent overdose deaths. We had 10 deaths last year. Which doesn't seem like a lot, but that's 10 too many.
Yeah.
And this year, I actually, in the month of March, starting March 1st, I made overdose incidents reportable. And since then, we've had, by the third week of March, we've had 5 cases reported already, where the use of rescue drug called Narcan was effective in preventing deaths in 5 people. So, so we always talk about the overdose deaths as being just the tip of the iceberg. You really don't know how many people actually have overdose incidents. And even making it reportable to public health, our goal in having people report it to us is not to get them in jail or to force them into treatment. It is to prevent another overdose. Because a person who suffers an overdose event is more likely to suffer another one. And what we want to do is help them so that that they have the resources available to prevent future overdose.
Is that self-reporting or family and
It's
friends reporting?
both. It's actually the reporting that is that we're asking for is from EMS, from our emergency management system, our EMTs, our law enforcement, our doctors, our hospitals. And we are asking individuals also, families and friends. Right now, we do not have available to us like this rescue drug to just hand out to everybody.
Yeah.
But we will in the future. And part of being able to have access to that is to actually report to us and just come and participate in the program, so that we can get that to you. And this is the one thing is public health and law enforcement. Drug use is both a public health and a law enforcement issue. And we need to separate the two but work together.
Yeah.
Because our job in public health is to save lives and prevent death. And it is not to get people in jail or arrested or anything like that. So I'm hoping that folks out there that have issues with substance abuse and want the help will trust to come to public health and work with us so we can get you the help that you need. And that this collaborative effort that we have entered in the last 6 months has just been overwhelmingly awesome.
Well, that's
It just everybody's just come to the table. It's why not?
Yeah.
And from our commissioners, our leadership in the community, to our law enforcement, to our sheriff's office, to citizens out on the street, and it's really nice to see that collaborative work coming together, and it really will be very, very good for this community when we succeed.
April is Public Health Month, and the Mason County Health Officer, Dr. Diana Yu. It's always nice talking with you, and
Thank you.
we'll check in a little while to see how things are progressing.
Thank you. Have a good week.